Assalamualaikum warahmatullahi wabarakatuh. Our group will talk about the mecamylamine is indicated for essential hypertension.
So, in this video, we will emphasize on how the drug is discovered, the medicinal chemistry of the drug, the mechanism of action of the drug, the main chemical indication and therapeutic use, and the main adverse effect of the drug.
Lastly, we will comment about the appropriateness of this drug in the clinical use or not.
Let's go!
Assalamualaikum. I am Nur Anis Suraya binti Arsad. First of all, for my part, I am going to talk about the discovery of the drug mecamylamine.
Mecamylamine is first introduced in the 1950s as an antihypertensive drug by Merck & Co. Company and gave a well-regarded hit. Due to some problem in 1996, Merck & Co. Company sold the inversing drug to Latent Bioscience. After a while, FDA has since approved a new manufacturing site and Latent Bioscience redistributed mecamylamine on the US market in May 2000. However, the drug is voluntarily withdrawn from the market in 2009. For the latest, the drug has been brought back to market in 2013 by Turing Pharmaceuticals, but currently the drug is often used as a research tool. Mecamylamine is a secondary amine drug. It is a potent drug which is a non-selective and non-competitive antagonist of the nicotinic acetylcholine receptors. Mecamylamine is the first orally available antihypertensive agent and ganglion blocker. Unlike other ganglionic blocking agents, mecamylamine is very well absorbed from the gastrointestinal tract and can cross the blood-brain barrier. It is also indicated for the management of moderately severe to severe essential hypertension and in uncomplicated cases of malignant hypertension.
I am Nur Izzati Fakiha binti Muhammad Nusaimi. I will explain about the medicinal chemistry of the mecamylamine. For the first part, I will talk about its synthesis, and for the second part, I will talk about its structure-activity relationship.
This is the chemical and also IUPAC name of the mecamylamine, the molecular formula and also the molar mass of the mecamylamine. In a rather strongly acidic medium to 5 degrees Celsius, give rise to 2-formamido-2,3,3-methyl-nocampheine. The cause of reaction may be considered as due to the addition of hydrogen cyanide to the 2,8 double bond present in the campheine moiety to yield the corresponding 2-isocyanate, which on subsequent dehydration gives the formamido derivative. Mecamylamine base is obtained by the reduction of the formyl function in the formamido derivative with lithium aluminium hydride, which may be converted into its hydrochloride salt by dissolving the base in an appropriate solvent and passing a stream of hydrochloric gas. The structure-activity relationships of the mecamylamine. Firstly, it is about the effect of various alkyl and aryl alkyl substituents on the amino nitrogen. As the size of the alkyl substituent increases, the activity will be decreases. This decrease in activity appear to be the greatest with branch alkyl groups cyclohexyl, benzyl, phenethyl, and phenylpropyl. Secondly, it is about the influence of ring methyls and bridge methylene groups as activity-enhancing groups. The angular methyls, the methyls at position 2, and the bridge methylene all possess an important functions in terms of enhancing activity. The angular methyl increase activity and produce a greater enhancements when there were fewer methyl substitutions on the other positions. There is an increase in activity when one methyl was substituted at position 2. When the angular methyl was present or absent. Addition of a second methyl at position 2 affected only a slight to moderate increase in action. The bridge methylene also acts as an activity-enhancing group, but it was more active as an enhancing group when the angular methyl was absent than when it was present. The hindrance will be too great when the alkyl group in the angular position is large, which can diminish its activity. Lastly, it is about geometry and optical isomerism. For the geometric isomer, the beta or SO isomer is somewhat more active than its corresponding alpha or endo isomer. The difference in activity of the two geometric isomeric pairs may also be explained on the basis of critical hindrances. The endo isomer is less active because the hindrance is more than optimal. The optical isomerism does not play a significant role in determining degree of activity.
Assalamualaikum. This is Soraya Ali, and I'll talk about mechanism of action of mecamylamine. Mecamylamine is a ganglionic blocker classified as non-depolarizing, non-competitive antagonist. Works as blockade by occupying sites in or on the nicotinic ion channel, not by occupying the cholinesterase itself. It prevents the stimulation of both synaptic receptors by acetylcholine released from the presynaptic nerve endings. The hypotensive effect of mecamylamine is attributed to reduction in sympathetic tone, vasodilation, and reduced cardiac output, and is primarily postural hypotension. It targets neuroacetylcholine alpha 2 receptors.
Mecamylamine binds to the non-competitive binding site of the alpha-4 beta-2 receptor. The binding site composed of leucine, valine, and glutamate amino acid. It causes the conformational changes of the binding site. Therefore, acetylcholine cannot bind to its receptor and the ligand-gated cation channel is blocked. So, the sodium and calcium ion cannot enter through the ion channel. The depolarization does not occur and the action potential is not transmitted to the postsynaptic neuron. The sympathetic vascular tone is decreased that causes vasodilation. Then, it reduces the systemic vascular resistance which reduces the arterial pressure. So the blood pressure is reduced.
Next, I will explain more about the interaction of the mecamylamine with the alpha-4 beta-2 acetylcholine receptor ion channel. First, the beta group of mecamylamine interact with leucine and valine in the receptor through van der Waals force. This is because both leucine and valine are non-polar amino acids, thus both can interact with the methyl groups. In the physiological pH, the nitrogen atom of mecamylamine is protonated. The positively charged amino group for the mecamylamine interact with negatively charged carboxylic group from glutamate residue.
Absorption of mecamylamine. Mecamylamine is almost completely absorbed from the GIT. Route of elimination. Mecamylamine is excreted slowly in the urine in the unchanged form. The route of its renal elimination is influenced by the urinary pH. Alkalization of the urine reduces and the acidification promotes renal excretion of the mecamylamine.
Alaikum, my name is Nur Shasha Fasiha, and I will be explaining the therapeutic uses or the indication of mecamylamine.
The thing about this drug is that it reduces the blood pressure abruptly, so abruptly that it should only be used clinically when the patient is having a hypertensive crisis. A hypertensive crisis is a severe increase in blood pressure that can lead to a stroke. This is when the patient has extremely high blood pressure, leading to damage of the blood vessels. The blood vessels become inflamed and may leak fluid or blood. As a result, the heart may not be able to pump blood effectively. Mecamylamine easily traverses the blood-brain barrier, inhibiting NACHRS in the CNS. It had even been reported that central effects of mecamylamine are obtained at 3-fold lower doses than those used to treat hypertension, 2.5 till 10 mg per day versus 30 till 90 mg per day. The lower dose results in fewer and more manageable peripheral side effects, and the receptors are involved in numerous physiological and pathological processes, making mecamylamine a potential therapeutic agent for a wide variety of disorders that affect the CNS.
Assalamualaikum warahmatullahi wabarakatuh. I am Mohammed Asmi Madahan. I am going to explain about adverse effect of mecamylamine. There are many side and adverse effects of mecamylamine due to its characteristic as ganglionic blocker, which seems to block everything. Firstly, there are few adverse effects in gastrointestinal system such as ileus, vomiting, nausea, and dryness of mouth. Ileus is a painful obstruction of the ileum or other part of the intestine. Secondly, mecamylamine also has adverse effect on cardiovascular system such as postural hypertension and syncope. Postural hypotension is a drop in blood pressure due to change in body position. For example, when a person moves to a more vertical position, either from sitting to standing, or from lying down to sitting, or from lying down to standing. Syncope is temporary loss of consciousness due to temporary reduction in blood flow that cause shortage of oxygen in brain. Thirdly, mecamylamine also can cause adverse effect in respiratory system such as pulmonary edema and fibrosis. Pulmonary edema is excess fluid in the lungs and accumulate in numerous excess in the lung lead to difficulty in breathing. Fibrosis is scar formation in the lung tissue leading to serious breathing problem. Moreover, mecamylamine can pass through blood-brain barrier, so it can affect nervous system. The adverse effects in nervous system are convulsion and tremor. Convulsion is body muscles contract and relax rapidly and repeatedly, resulting in uncontrolled shaking of the body, related to certain seizure disorder. Tremor is abnormal, repetitive shaking movement of the body. Other adverse effects of mecamylamine can occur in orogenital system, such as urinary retention and decreased libido, and mecamylamine also can affect vision, such as blurred vision.
Hello, my name is Raouf, and I will explain about the appropriateness of mecamylamine as medication for essential hypertension. As for the appropriateness of the topic statement, which is mecamylamine is indicated for essential hypertension, we concluded that this drug is not appropriate for essential hypertension anymore. This is because mecamylamine is proven to cause too much adverse side effect. Thus, it is no longer used as medication for hypertension, but rather only as research purpose. Adverse side effects that caused by mecamylamine include allergic reaction, abdominal pain, postural hypotension, and other less serious side effects such as nausea, vomiting, constipation, dry mouth, dizziness, fainting, and difficulty in urinating. Sudden stop in consuming mecamylamine will also lead to rapid rise in blood pressure. Taking mecamylamine along with other drugs can also lead to another prominent side effect. As such, mecamylamine should not be taken with antibiotic, anesthesia drug, various other drugs to lower blood pressure. Patients that have other disease should also not take mecamylamine unless with physician guide. Patients with atherosclerosis, glaucoma, kidney disease, and heart attack should get pharmacist counsel on how to take them. Mecamylamine is listed in category C of FDA pregnancy, meaning that this drug has unknown effect on pregnant mother and her baby. So pregnant mother are not allowed to take mecamylamine due to high risk it can cause to her pregnancy. Mecamylamine is not a specific drug as it has broad action. Mecamylamine, as we all know, is a ganglionic blocker, which is a type of medication that inhibits transmission between preganglionic and postganglionic neurons in autonomic nervous system, which often by acting as a nicotine receptor. Mecamylamine is a non-selective ganglionic blocker, thus it tends to block random nicotinamide receptor on postganglionic autonomic neurons. Due to its broad action, which include blocking sympathetic and parasympathetic system, thus it was replaced by a more specific drug. As mentioned earlier, even though mecamylamine is no longer used as antihypertensive, they are now used as research tools for study purpose. This is because they are believed to have significant effect on helping smoking cessation. Some studies concluded that at low dose of mecamylamine, they are able to reduce the desire of subject to smoke. Mecamylamine given orally in combination of nicotine patches are able to prolong the duration of continuous smoking abstinence. This combination are also proven to reduce ad-lib smoking, smoking satisfaction, and smoking craving. The studies also found out that daily administration of mecamylamine alone for 4 weeks prior to quit are also more effective than nicotine patches. Since mecamylamine is no longer used as medication for hypertension, there are some drugs that have replaced mecamylamine and they are proven to be better in managing hypertension. To name few, sinopterol and benazepam. Both of them are angiotensin converting enzyme which help relax blood vessels by blocking formation of a natural chemical that narrows blood vessels. Another drug that good to manage hypertension is candesartan and losartan, which are angiotensin 2 receptor blockers. Clothalidone and amlodipine are also better to manage hypertension. Clothalidone able to eliminate sodium and water from body which reduce blood volume, while amlodipine able to help relax the muscles of blood vessels which slow heart rate subsequently.